can go ahead and get started. Everyone nice and comfortable. Just a check. This is not the AI session. We're the other side of the brain for this next 50 minutes or so. So hello, everybody. My name is Paulette Frank. I'm the Chief Sustainability Officer at Johnson & Johnson, and I have had the privilege of working on environmental stewardship at J&J for almost 30 years. And I'm really excited to bring this topic of climate and health to the Climate Week community for the past 8 years. So we've had sessions like this in a room a lot like this for the past 8 years, and I'm really curious how many people in the room have been to one of our sessions in the past. Okay, so we didn't scare you away. You came again, awesome. So just a show of hands, just for the visual, how many people is this your first time? Okay, so yeah, the word got out. It really, truly is amazing. 8 years ago, in 2017, when we brought up the idea of doing a topic on health at Climate Week with the climate group, they were very excited to do it, but didn't know quite where to put us because there was no real space for health on the agenda. So we sometimes got put into transportation, we'll keep going, and sometimes into ag. And a couple years ago, they created a whole track, a whole partnership opportunity to support the topic of climate and health. And I'm very proud that we were the first health sponsor, we're the second health sponsor, and hopefully we'll continue to be the health sponsor, because we have believed that connecting nature and environment to human health was a really important catalyst, that it would bring people together around the topic of climate and environmental stewardship. And it brings people like us together in a room like this. So just to lean into the theme of power on, I think we know a little bit about powering on at Johnson & Johnson, particularly when it comes to environmental stewardship. I've mentioned before we have had public environmental goals for over 3 decades, but what was really cool, what I recently realized, one of our colleagues was digging through our files and found a memo referencing our first energy efficiency program. Do you want to guess the decade? Nope. 72. And I actually remember being a little girl in my mom's car waiting in line for hours for gasoline in the early 70s. So when I saw that date, I was like, oh, that makes a lot of sense. But that's how far back. Just the notion that we had to be respectful and responsible with the natural resources that we're privileged to use at J&J. So back in 2017, like I said, we brought this topic of climate and health. And actually, I was 2 years in my current role at that time. And this notion of environmental stewardship had always been kind of core to our values at Johnson & Johnson. But around that time, we came out with our purpose statement, which was to profoundly change the trajectory of health for humanity. And seeing that statement in writing kind of inspired me, our team, to say, you know what, it's certainly part of our values, but we can't achieve that purpose without a healthy planet as well. So more and more we started to connect the work. Certainly it's a value and we have a responsibility, but it's also core to our business and to our purpose. So that's also what inspired us to bring this topic to a broader stage. And then in 2020, we also brought another announcement to the Climate Week stage, which is around our renewable electricity goal at that time. And all I'll say about that is when we first announced our intention to go to 100% renewable electricity, we called it an aspiration. This was in 2015. And the aspiration at the time was to achieve 100% renewable electricity by do you want to guess the decade? 50. That was the dream in 2015. In 2020, we said, you know what, it's not an aspiration, we think we can actually hit it by 2025. And I'm very proud to say we are very well on our way to achieving that in 2 months. One other announcement in 2022, so we're kind of getting closer to today. In 2022, We were proud to announce our partnership with AmeriCares and Harvard Sea Change to support the climate resilience of healthcare clinics in some of the most vulnerable communities in the United States. And we're going to hear a little bit of an update on that program today. And like I said, last year was our first time being the health program partner for Climate Week. So that brings me to today. So we're still trying to bring the human and the health element of climate change to this audience, but what's different today, you'll hear a couple new themes, especially for those of you who have been here for the past couple of sessions that we've run. We're really becoming very focused on the healthcare workforce and how do we support the people who are literally on the front lines when disasters strike, waking up, getting out, trying to get to their clinic or place where they're going to serve their patients, and trying to be there when they're going through their own traumatic experience during these types of events. So we're very focused on the healthcare workforce, and in the past we've talked a lot about preparedness, preparing healthcare clinics to be resilient, also during events and after, in particular after, because we call them, just talking events, we call these things events, but the reality is they go on for a really long time. The aftermath goes on, and it's like trauma that people they need support to get through that. So we're going to talk a bit about that today. And in case you were even for a second thinking about leaving early, don't, because you'll miss a really big announcement. Just saying. So to start us off, I'm going to invite Rachel up to have a conversation one-on-one and give us her experience of living through a very specific traumatic event, Hurricane Helene, a year ago this week, hit where Rachel calls home. And she operates a set of clinics, Mercy Urgent Care, in the western part of North Carolina. And she's going to share with us, she's going to give you a very vivid picture of what that experience was like from her point of view. So, with that,
thank you.
Have you ever been on a stage like this?
Well, maybe not exactly like this, but I've been on a stage before.
You're not nervous at all?
Well, I don't know about that, but not one that's got this really nice boardwalk. Wherever this is, I want to go there.
And absolutely no need to be nervous. We are amongst very good friends. So Rachel, can you, before we really get into the experience that you're going to share with us today, can you just let the audience know what does Mercy Urgent Care do? Who do they serve?
So Mercy Urgent Care is this amazing organization that's headquartered in Western North Carolina. We are the market leader for urgent care and occupational medicine services in all of Western North Carolina. We're an independent nonprofit urgent care system, and what that means is that we're not affiliated with a hospital system, and we're not a for-profit urgent care, which is typically the model when an urgent care is independent of a hospital. So we treat patients regardless of ability to pay. Mercy saw last year close to between 80 and 90,000 patients. We were right at 85,000, and to put that number in perspective, the city of Asheville, which is the largest city west of Charlotte in the state of North Carolina, has just over 90,000 residents. So Mercy has a huge impact on public health in Western North Carolina and some of the most need-stricken regions of the state. And every single one of our locations, we had 8 locations in 5 counties at the time of the hurricane, where each location was in the disaster zone. So every single location.
So can you share with the audience, paint that vivid picture for them of how that storm impacted your community and your clinics?
Well, you probably had read or saw on the news that Hurricane Helene for Western North Carolina was the worst disaster in recorded history. To put that in perspective for us, Biltmore Village, which is this beautiful part of town, has all these historic markers, or had them, that marked, I think, the flood of 1916, if I'm remembering correctly. That was, the turn of the 20th century. It was this catastrophic flood, and you could see where the water line was. And so for us, that was kind of the marker of disaster, right? Well, Hurricane Helene, I mean, forget it. The water line was way beyond anything that happened in 1916. So it was, in fact, the worst disaster in our recorded history. I don't know how to describe it other than it was just beyond my comprehension. And for anyone that I spoke to or connected with in Western North Carolina in the wake of the storm, I'm yet to meet a single person who said they could have comprehended what we experienced there.
So why was it so important to open the clinics besides the obvious, that, as quickly as possible?
So I will tell you, prior to my current role as CEO, I was actually involved in drafting the disaster plan for Mercy Urgent Care. I was the chief administrative officer and was leading Mercy through the global pandemic at the time. And we really got to a place where, when we were looking at our disaster plan, we kind of got to the end of it where we said, okay, if all of these things happen, we're probably not even going to be around, or there's not going to be anything we can do. So, this is as far as the urgent care is going to go before the community won't have it. But what we realized in the wake of the storm was that if the entire healthcare ecosystem is absent in a disaster that's claiming dozens of lives and injuring others, then of the very few healthcare organizations that are able to open their doors, there's going to be additional death because they will be overrun. And that's exactly what was happening. Our largest hospital system that's headquartered in Asheville, they did a great job of being as prepared as you could possibly be for an incident like this, but they were seeing triple their volumes, and for all kinds of things that they didn't necessarily have to go to the emergency room. And so we realized pretty quickly, even though we didn't have water, we didn't have power, one of our locations had a catastrophic leak, and there were buckets of water coming into the building, and we just realized, well, we've got to figure out how to run a center without water or power, or get a bucket and take notes on a piece of paper because you don't have internet or cell service. We've just got to figure it out, because if we don't, more people are going to die. And of all the times that the community needs health workers in the wake of disaster, that is the time when they need you the most. And so we made it happen. I can't say for sure that we were the first non-hospital healthcare organization to open our doors in the wake of the storm, because I don't have confirmation of that, but I am certain that if we weren't the first, we were one of the first. We had our first facility open within 3 days of the storm.
So it's one thing to open up the doors of the clinic, and then it's another to support the staff, the health workforce, to be able to get there and then serve the patients. Can you share a little bit about some of the stories of the health workforce and the challenges that they also went through?
Yes, I'm happy to share this because these are my absolute heroes. One of the things that I have now learned since going through a disaster like this is that the initial stage of disaster response is the heroic stage, for lack of a better term. I didn't know this until I've now been educated on it and I've lived it. It's where people do these superhuman things to ensure that they're helping others. And one of the best examples I can think of is the day after the storm. Of course, we had no cell service, we had no internet, there was no way to connect with anyone. I wasn't even sure that all of my staff were alive, which was a just unfathomable thing to think, right? But in not being able to communicate with anyone on the team, I had one provider who had multiple trees down in her driveway. She couldn't get to the center where she was scheduled to work, but she was absolutely not going to be the reason why we couldn't get our doors open that day. And so she walked miles, multiple, to get to the facility so that we could open our doors. And the only way she could get there was to walk because she had to climb over multiple trees. We had another staff member who is mother of 3, incredible woman, was with the first team at one of our Asheville locations to open our doors, and she had just lost her home and all of their cars. And of course, I walked into the center and I said, "You do not have to be here. We will get coverage for you. Tell us how we can help you." And she says, "Rachel, just you coming and telling me that is blessing enough. I am fine, I'm blessed, and I'm here to serve. Don't worry about me." And I was like, well, we're gonna do more than that, you know? Yeah, but the superhuman, I don't have words for it. Those were just 2 examples, but they're my absolute heroes, and that's what they did day in and day out. And they had encountered loss of property, loss of life. Some had, one person had lost a family member, one had witnessed a neighbor drown. These people had gone through absolute trauma, and then they walked miles to get to the facility so we could open on time. That's what they had been through.
So Rachel, how did you support your staff? What did they need, you know, to be able to handle and deal with trauma like that?
Well, I am not a mental health professional, and so I realized pretty quickly that the thing that I was good at doing was the things that a CEO needs to do in the wake of a disaster: make some quick decisions and put things in order to be able to run the facility. But my skill set is not in providing mental health support, and that's where I am really blessed to have a team of incredibly intelligent people with different strengths who connected with AmeriCares. In our case, was right there on the floor with us shortly after we'd gotten our facilities open to provide that mental health support. And they came into the boardroom, sat down with all of us on the leadership team as we were processing the trauma while still leading through it. And then they visited every one of our facilities to meet with each of our healthcare teams to provide mental health support, and also one-on-one counseling as needed throughout the day. It was really incredible. There were some other resources that were available to us that I certainly, in my role, encouraged people to take advantage of, that were available because of how extraordinary this event was. I can't think of the name of the mental health. It was online counseling that's a thing now that had provided, I think, 3 or 4 months of free mental health services for people that were in the disaster zone. So our head of HR was, again, everybody has their respective superpowers, and he did a knockout job of creating a hub of support for our staff and connecting to mental health resources. We created an employee disaster assistance fund where if you needed dog food, if you needed paint, whatever it was you needed, we were going to make sure that we were getting it to our people to just help them heal. It was different than anything we've ever done before, but it was the right thing to do at that time, and we've, of course, since learned from it a formula for, God forbid if we ever go through it again, for the way to take care of our people should it happen again.
Well, thank you for sharing your experience with everybody and showing us that there is still the very best of humanity out there. Thank you, Rachel.
They're in Asheville.
Thank you. Thank you. All right. Wow. I'm going to invite two more guests up to join us on the stage. Dr. Cecilia Sorensen is the director of the Global Consortium on Climate and Health Education at Columbia University. And an old friend, Dr. Julie Verghese, is the Senior Vice President of Programs and Chief Medical Officer for AmeriCares. And old meaning we've been friends a long time. All right, we're going to start, Cecilia, with you. And so can you tell us a little bit about the work that you do?
Thank you so much, and thank you all for being here. So I'm an emergency medicine doctor. That's my background, that's my training, it's what I still do. And I came into the climate health space. I was actually doing a post-residency training program in climate and health policy, and I found myself working in Syria in a refugee camp, right? And some of you are probably climate and health folks here, and you understand that, one of the things that might have contributed to some of the conflict in this area was a very, very prolonged drought, which killed 80% of the livestock in Syria, created very, very difficult living conditions, and contributed to a lot of mass internal and external migration in the region, thought to contribute to some of the civil unrest. Anyway, we were working in a refugee camp with tens of thousands of refugees, and I was one of the only female doctors in this group, and so I was running the OB-GYN tent, right? So imagine this tent out in this desert, seeing 50 to 70 patients a day, right? Showing up with all different types of emergent and chronic OB-GYN complaints. And there I was, and had an ultrasound machine, and I was seeing patients, identifying emergent conditions, getting people transferred. And these three women walked up to me, in perfect English said to me, "Do you need help?" And they were all refugees themselves. And I said, "Yeah, please." And they, turns out, were nursing students who had fled Syria in the midst of the crisis. And they hadn't finished their degrees, and they were very quick to tell me that, but they said, "We speak all these different languages, we can help." And I ended up staying in this refugee camp for about 6 weeks, during which time these women showed up every single day at 5 a.m. and started working, just doing all the things that needed to happen. And I started teaching them how to use the ultrasound machine. I started teaching them how to interpret urinalysis. I basically taught them everything that I was doing, and we spent 16 hours together a day. And when I left, they stayed. And to me, I know they're still there taking care of that community. And I left Syria, and it was an incredible experience, and I still think about these women and I say, we have to train health workers everywhere in the world, because they're going to stay in their communities and continue to take care of people. So flash forward, I got this opportunity to work at the Global Consortium at Climate and Health for Climate and Health Education, who has a mission to ensure that 100% of health workers globally have the knowledge and skills to prevent, prepare, and respond to climate and health impacts in their communities. And so here, I'm just thinking about the three women in Syria. We're treating heat-related illnesses. We're treating issues related to poor water and sanitation, all the things that we're seeing globally related to the health impacts of climate change. And so that's what we do at the consortium on a day-to-day basis. My team is here with me. So we train health workers. We train health workers ranging from frontline community health workers to policy and decision makers to try to create both the systems that can withstand climate-related events as well as educate the frontline health professionals working in those systems. So I'm really privileged and to have brought this whole thing full circle, and that's how we got here today.
Thank you. So Rachel gave us a view of her experience and how some of the effects of climate change have impacted her. Can you give us a broader perspective of how the impacts of climate change are affecting the healthcare workforce?
Rachel, I mean, what you lived through is incredible. I've never lived through that. But what we know and what we understand from the health workers we work with is that this is happening on a global level in so many parts of the world. The floods, the increased storms, the heat waves, and we're also simultaneously faced with a global workforce shortage, right? And so as we're seeing disasters, as we're seeing increased communicable and non-communicable diseases from climate change, we have these dedicated health workers, right? These people who have self-identified that they're gonna help their communities, showing up every day, working in harder and harder, exhausting conditions, right? And I think there's sort of the stress that they're under to take care of sicker and sicker patients, and also the lack of system support to do it. and sometimes the lack of training to be able to know exactly what to do, right? So I think it's tough to be a healthcare worker out there right now. I think the pandemic wore down a lot of people, and I think that we're seeing escalating disasters, right? And so this resilience that you guys were just talking about, this mental health resilience among health workers, I don't think we can take it for granted, right? Eventually everybody has a breaking point, and we have to think about how we build that into what we're gonna do in the future.
Yeah, walking miles to serve was probably not in the job description, but thankfully didn't matter. Julie, so some people in the room may be familiar with AmeriCares and how you've been there for decades following natural disasters to support communities, but you also do a lot of work to help communities and healthcare clinics be prepared for these types of events. Can you share a little bit about the work that you're doing to help prepare the healthcare workforce?
Sure, and thank you, Paulette, for just giving us the space to raise more awareness and visibility about such an important topic, and for you all being here. So AmeriCares has a very long history of preparedness work, as you said, and just hearing both of your stories, Rachel and Cecilia, healthcare workers, there's so much that they deal with in kind of a day-to-day basis, taking care of patients, health education, and so AmeriCares is really fortunate to be able to come alongside and provide resources, support, training, capacity building in the preparedness space. And so we have a very long history of that. About 4 years ago, we were able to collaborate with Harvard Sea Change and develop a climate toolkit. So recognizing, I went to medical school, I did not have courses on the impacts of climate change on my patients, but we were able to create this toolkit that helped frontline healthcare providers learn more about the health impacts of climate change on their patients' health. And so we were very fortunate to focus on the free and charitable clinic sector, community health clinics. This is a really important safety network that takes care of 35 million patients across the US. These are uninsured, underinsured people that really are often quite vulnerable to the impacts of climate change. And so we were really fortunate to start that work a few years ago. And our climate work has really been growing over these last few years. So Paula, as you mentioned, in 2022, we were really fortunate to receive generous support from J&J, again, to collaborate with Harvard Sea Change and launch a program that is Climate Health Equity for Community Clinics. And this program specifically focuses on locations in the US that are disproportionately affected by climate change, caring for vulnerable communities, and then being able to provide additional resources to really understand those health impacts on those vulnerable communities as well.
So Julie, 3 years in, can you just share a little bit about the impact that that program has had?
Yeah, so our goal with the program was to really build climate resilience among these frontline clinics. And we set out with the goal of reaching 100 clinics across the US. And I'm really happy to report that we've actually exceeded our goal. We have 170 clinics that are engaged in the program. Again, really partnering with them to help build that climate education and resilience beyond the clinic walls. So beyond the patient care interaction and the health education, and to be able to bring that support that is so important. And so of the 170, 80 clinic partners have also completed what we call action plans. And so these are action plans specifically to deal with extreme heat, with wildfires. And so the clinics themselves were key contributors in developing an online assessment tool that provides a specific plan for their clinic that is individualized for their specific clinic. And this summer, we were fortunate to be able to award what we call heat grants. And this provides funding for clinics to be able to provide practical supplies for their patients. So not only are we providing support to our clinic partners on the health education side, but also really providing practical tools. So things that seem so simple, like thermometers, fans, air conditions, electrolytes, but really make such a difference in terms of supplementing that climate health education with practical tools. We know that in the US, extreme heat is the #1 weather-related cause of death. And we've seen that with our clinics who have completed those heat health action plans, they're actually even more proactive about going out, educating their patients on those risks, what to look for, whether it's heat exhaustion, heat stroke, but being able to supplement that health education with practical resources right there it really makes such a big difference.
Thank you. You can tell, we're really about painting this very vivid, practical picture for you. And this is not super complicated stuff. It's just a matter of providing a simple tool, engaging people so they're part of the assessment for their specific needs, which is something I did want to ask you to kind of dig into a little bit more, because I know that's something we learned along the way, is how important it is to engage the healthcare workforce in those specific clinics to adapt the tools to their specific needs. So can you just paint that picture for us of how we engage with the healthcare workforce in the solutions?
Yeah, absolutely. I mean, that is core to this work for us. We certainly don't want to come in with our own approaches, and certainly there's a lot of data and evidence out there, but we really needed to be solutions oriented with that local context. So hearing feedback directly from our clinic partners, we had kind of peer learning groups and different approaches that we took to really hear from the frontline healthcare workers themselves, listening to what are those challenges that they're facing, what are the realities that they're dealing with day in and day out, and then what's going to be those practical solutions. And so really having what we call kind of that human-centered design approach every step of the way in terms of this work was really critical.
And fortunately, we also learned that the healthcare workforce is not shy about sharing their perspective
lot of
when they
feedback.
see something and that's not going to work here. So that's been a good thing, a very good thing. So we're going to transition to, so we've talked a bit about the work in the U.S., but we're also you're doing amazing, both of you are doing amazing work outside the U.S. Cecilia, can you start us off by sharing with the audience your work in India and how it's different and unique?
Yeah, absolutely. Well, we do use the AmeriCare resources, by the way, which are incredible. In India, we have had the opportunity to work with an organization called Swasti, which is this incredible community-based organization that is really focused on improving primary care access throughout India. And in India, it's quite unique. So there's this workforce of community health workers. They're called ASHA workers in some contexts. And there's over 1 million frontline community health workers in India. We don't really have that in the US, so it's kind of a little bit hard to describe. But they work in government roles. They also work for civil society organizations. And these health workers are the ones that really, I would say, go that last mile. And they're also folks who live within communities. They tend, in my experience, from what I've seen, to be younger-ish women who just really kind of care about people around them. This humanity aspect of frontline community health workers. It's so, I think, poignant. And so we had this opportunity to work with Swasti to engage community health workers in a district called Andhra Pradesh, which is in the south of India, in trying to equip them to reduce the health impacts of extreme heat. And so think about it, if we can sort of reach 1 million frontline community health workers who are in communities, who know who all the pregnant women are, who know who all the elderly folks are, who know who has disabilities, and there's a disaster, that frontline community health worker knows where the problem's going to be in that community. And so we see these folks as really important change agents when it comes to building adaptation. And so this is an area where we are doing a lot of focus.
So hopefully you're gaining an appreciation for how the local context is so important when you're trying to bring solutions that are intended to help people, but they have to be meaningful in that local context. Cecilia, can you just share an example of something that you learned from a healthcare worker that you integrated into, like something that you were like, oh, I would never have thought of that?
I mean, it has been really fun. So we've been running these trainings in partnership now with the Ministry of Health of Andhra Pradesh. We run 2-day train-the-trainer cascading training programs. And this past year, we were able to train individuals from 90 different primary health clinics in this one district. And we work with the community health workers to design these scenario-based cases, right? So we try to have a lot of interaction in our workshops, right? Role play and, eliciting stories and building on existing information. And in India, as in anywhere, there are many cultural practices having to do with health, and particularly with heat. And so we have been working a lot with our community health workers to understand what types of recommendations would resonate and what makes sense, and what are people actually already doing when there's severe heat in the community. And so one of the questions that health workers get asked a lot is, what should we eat? right? Like food is medicine, right? So people, what should we eat? And so we sort of would sit down and say, well, what fresh vegetables and, for example, like very water content rich fruits are there available in the market during this time of year, right? And trying to incorporate that into the recommendations they could give. We also were able to go with the community health workers to the homes that they were visiting and look at the landscapes, how houses are laid out. Sometimes there's kitchens that are inside the houses. Well, could the kitchen be moved outdoors during certain seasons because there's open courtyards, right? So things like how can you make those small changes in how people are going about their domestic day-to-day, to make them more heat vulnerable at home, less heat vulnerable at home. Other practices that we were seeing were, one practice is to pour oil on your head when it's hot out, and this is thought to cool the body, although we were really thinking about this and saying that actually could prevent sweating. So maybe that's not a great idea. But another practice is to use neem water, so water which is seeped in this neem plant, which has cooling properties, and then so do sponge baths with neem water. We're like, that's great, right? So we were able to work with the community health workers to sort of understand what local practices were and try to emphasize the ones that seemed to be good and try to de-emphasize other ones. A lot of the workers, obviously heat exhaustion is a big deal, so they tend to chew betel nut, which is a stimulant. And we know chewing stimulants, obviously in heat, is gonna increase vulnerability. So we were had to sort of address those practices as well. So we learned a lot, and we're able to sort of incorporate it in. We also, the community health workers came up with the idea of going in teams during heat event days. And we actually incorporated an entire module into the training on how to keep yourself safe. It was actually an afterthought, which I feel a little bit I can't believe we didn't think about this. But now we have a module on how to keep yourself safe, because I think a lot of the health workers were thinking also about their own risk as we were describing impacts.
So this is clearly very meaningful work. Can you share what this work and the support that you provide has meant to the healthcare workers that you've worked with, and what has it meant to you?
Oh, that's a great question. The way I sort of have seen this, well, first of all, the outcomes of this are that we have reached 4,500 frontline community health workers literally in 4 months of cascading training, which is incredible. It also spurred this district to create a heat action plan, and education is a huge part of that. So systematic change, all that stuff, we're really happy. When we meet the workers, first of all, they don't like being on video and they get very nervous, so it's hard to get a good story from them. But what I love about it is these are young women who are getting empowered with information. And they then have evidence-based information that they can take into the field to protect people around them, and they are trusted. And we have done studies before and after, and we see that their self-reported confidence goes up. We ask them, how confident do you feel in talking to your community about heat? And it's low, and then at the end, it's high. And we do that strategically. We try to have role playing, and what would it be like if you were educating somebody about heat? And we make them practice, right? And it's fun, it's playful, but their confidence goes up. And to me, that's huge, and that's been associated with behavior change, right? If people say they are confident, they tend to do stuff. So it's been exciting to watch this program grow. Thank
you. My time monitor is flickering at me. Okay, I'll just look at my watch. Julie, can you share, so we've recently expanded the clinic work to the Philippines. Can you just give a quick overview of what that program is, but more importantly, how we had to adapt to a very different context?
Yeah, absolutely. So we were really fortunate to build off of the success of the U.S. Climate Toolkit to the Philippines. This summer, we launched a climate health resilience toolkit for health centers, working in partnership with the Philippines Department of Health, and again, collaborating with Harvard. And what we saw is that we had to adapt to what the local context was in the Philippines. So in the Philippines, they're often faced with recurring typhoons, as well as extreme heat. So not just facing extreme heat here in the US, we saw that in the Philippines, they were also experiencing similar challenges, and actually earlier this year had to close a number of schools around Manila and other provinces. And so we had to, again, kind of use that local context to adapt the toolkit build out in the Philippines. And so we were able to build resources targeting 4 specific groups. Again, those frontline healthcare workers, community members, that was a new component, I would say, compared to the US clinic work, again, that was based on the local needs and feedback that we got from our partners, as well as, again, clinic administrators and the patients themselves. And I'm really happy to say that, again, kind of facing those challenges with extreme heat, the Department of Health included our heat guidelines from the toolkit into their national guidelines. So again, kind of what Cecilia said, that systems level change is so important and not kind of being siloed in our approaches. And so those guidelines are now in use at 3,800 facilities across the Philippines. And that is, everything from hospitals to primary care clinics to smaller rural health units as well.
That's awesome. So we're going to actually give a pause from speaking a little bit and run a 2-minute video so you can we're going to bring you to a clinic in the Philippines. So you can run the video, please.
I am John Paul Verdadero, Nurse 2 of National Health Workforce Support System of Department of Health. Our patients mostly come from disadvantaged communities, and many of them are farmers, construction workers, rolling vendors, tricycle drivers who spend long hours working under the sun. A lot of them deal with chronic health conditions such as hypertension, diabetes, chronic kidney disease, respiratory problems, and even those struggling with their mental health. Extreme heat affects our patients. We have observed an increase in heat-related illnesses, including heat exhaustion and heat stroke. The toolkit has been incredibly helpful in providing practical strategies to educate our patients on how to stay safe during extreme heat. The printed materials and flyers you provide are easy to understand yet highly effective. We've also used the toolkit's recommendation to enhance how we manage cooling areas and to ensure access to hydration in our facility. We constantly encourage simple but effective practices like staying in the shade, drinking plenty of fluids, and taking breaks, especially on peak hours. And those are small actions that can truly save lives.
So I can't believe how quickly the time has gone, and we still have a really important topic that we want to cover around the mental health support of healthcare workers following a very traumatic event like a hurricane or a wildfire or an extreme heat event. So Rachel, how are you doing? A year later, how are you and your team doing?
Well, I think we're doing, boy, that's a tough question to answer. We're doing as well as we could be doing thanks to the support of community partners like AmeriCares and others who have graciously provided the resources that we've needed to be on our quickest path to healing, whatever that looks like, right? It's different for everyone else. I can tell you a year later, I'm about as encouraged as I could possibly be for our future in spite of what we have been through in our past because of the many angels among us who have just been integral to our recovery. Julie had, I wish I could just have, well, this will be on tape, so I'll have it. You hit the nail on the head when you were talking about the healthcare workforce, though, and I say at Mercy, and I say it jokingly, but I'm very serious. There are easier gigs than healthcare in the workforce, but thankfully, and I say this to them, and I mean it. Thankfully, we're so purpose-driven that we show up, even though it's hard, because it's necessary for public health, and thank God that they do make that choice. But organizations like AmeriCares make that choice an easier one to make in spite of the fact that it's always going to be a hard job. So a year later, I think Mercy is in as good a place as we could possibly be, in part because of that community support.
Thank you, Rachel. So Julie, Rachel mentioned the mental health support that AmeriCares has provided, that sort of post-event support. Can you tell us a bit more about that work?
Sure. Yeah, you never wish for any community or clinic partner to go through a devastating natural disaster. Particularly, Rachel, just hearing your stories really brings home this type of work. It is a real privilege to come alongside clinic partners and to be able to support them, not only in the times of the immediate disaster, but then to stay and to be able to be part of that recovery process. And so mental health is a big focus for AmeriCares, being able to come alongside and provide that initial sort of, whether it's psychological first aid, crisis stabilization, coping skills, coming alongside the health workforce and training in stress management. Again, sounds so simple, but in the heat of that moment when healthcare workers are experiencing that dual burden of being on the front lines, supporting their communities, but also being impacted themselves and going through their own grief and loss journey, it really is important work. As Rachel said, all of our community partners make such a difference. We know that the next disaster is coming. It is not just a one-time incident, but we know that the next emergency is just around the corner. So being able to provide that support is so critical to communities.
Well, thank you, Julie and Cecilia and Rachel, for sharing the stage with me. I can tell you out there up here, it is an emotional roller coaster. But in the end, this is why we feel so strongly about bringing this conversation, and we have, for the past couple of years. And it's really to end on a note of optimism, to show you the very best of humanity is still out there working hard. And you heard heroes, angels. There are lots of them still out there. So I hope that we've filled your tank with a little bit of optimism, and that we've given you some real practical understanding of the work that's happening and still very much needs to be supported to keep going. And with that, I'm going to transition to my colleague, Allison West, who is the J&J's Vice President of Charitable Solutions, and she's going to come up here and share an announcement with you. Welcome, Allison.
Emotional, I don't think cuts it. We all knew that this was the case. We knew these stories, but to hear it coming from your mouth and the reflections of what happened to your team and you, it's really quite touching to hear your story. So thank you. We know that natural disasters are increasing. We know that they're coming with increasing intensity, and we also know that these heroes have to deal with so much after the media attention fades. And making sure that we are doing everything that we can to support these healthcare workers is absolutely critical, because this is going to be our future. And so as these healthcare workers step forward, we've heard and we know that they need resources, they need training, they need support for themselves. And at Johnson & Johnson, we believe that supporting healthcare workers is one of the most important investments that we can make in helping communities build more resilient health systems and to help the people who live in that community. That's why today I am honored to announce that the Johnson & Johnson Foundation is making a $1 million commitment to AmeriCares to strengthen our healthcare workforce's ability to be prepared for and respond to natural disasters. This funding will enable rapid response to emergencies worldwide, and also supporting AmeriCare's year-round efforts to support healthcare workers and communities in need. With this support, AmeriCares can deploy emergency response teams and surge staffing, pre-position medicine and supplies so that they're ready when the disasters happen. Importantly, provide that psychosocial support and resilience training to healthcare workers who carry that emotional burden as they're caring for all of us. And importantly, help the clinic itself repair, restock, and restore after the disaster. This builds on a 40-year relationship between Johnson & Johnson, the Johnson & Johnson Foundation, and AmeriCares. The power of that relationship was shown just a year ago. We knew that AmeriCares was going to be out responding to both Helene and Milton, the hurricanes, and we were so proud to join and support with funding the work that we were doing to support clinics like yours. So we are really happy to share that this is part of our overall initiative in Johnson & Johnson called the J&J Care Community. And this is where we have a new platform focused on championing healthcare workers and connecting communities to care. In a world where these natural disasters are becoming more frequent, more destructive, we must ensure that the healthcare workers have the tools, the support, and the training that they need, not just to respond in the moment, but to really be resilient enough to deal with what's coming next and next and next. Together with AmeriCares, we're making sure that we'll be ready when the next storm, wildfire, or heat event occurs, and that our healthcare workers are ready so that communities are stronger, safer, and better equipped to heal. So thank you all for everything that you're doing, and we're so proud to support the work through our partnership with AmeriCares.
Thank you, everybody. Nailed it. Nailed it.